Okay, all right. So, how long has it been since we did the surgery?
24th.
Okay,
Right?
yeah, it's been honest.
Yeah, I picked you up at. I think you were done at.
Yeah,
They
so
called it
24
115 or
So
something.
you did top and bottom teeth,
Mm-hmm.
right?
Mm-hmm.
And tell me, as far as pain wise, what are you at as far as pain right now? Scale of 1 to 10.
0.
10 being the worst, 1 being no pain.
No pain.
Awesome.
Wow.
No pain.
That is that in itself is like a miracle,
I bet
right?
it too.
No,
You're like,
yeah.
this is stressful for me. My teeth are hurting.
Yeah, no, it's been so good.
Awesome.
I can tell I'm slurring.
That's
Yeah,
okay.
that's gonna be normal,
Yeah.
I'm sure, for a while.
Okay, so first of all, I just want to say thank you for trusting
Oh,
us.
thank you.
The surgery went fantastic. Like I said, aside from Dr. Hendricks losing all the information this morning and having to start over, it was awesome.
You didn't hear that.
Oh,
You
wow.
didn't hear that. Yeah.
It's a great story. It was kind of funny. We had someone that was flipping the breakers and actually flipped the breaker on accident when I was working on it.
Oh no.
So, anyways, learned a lesson. But all right, well, I'm gonna have you go ahead and look at him.
Okay.
Okay, and you're gonna go ahead and take off your mask. Let him see it for the first time.
Not opening
And
my
you're
mouth.
welcome to film if you want right now.
Okay.
Okay.
Oh wow. Wow, they're beautiful.
Is it? Are they? Is it like it's one tooth?
Wow, yeah.
Oh.
Awesome. Okay.
Okay.
Now, go ahead and just go ahead and scoot up there
Mhm.
and go ahead and take a look for the first time.
Oh my gosh. I don't know how to smile. Oh, and you can't see my bottom teeth. Oh, they're so pretty. Oh,
Mhm.
my gosh, you did amazing, and I didn't even follow my homework. I didn't even bring in smiles. Oh,
She kept mentioning that.
I did. Oh my gosh, it looks so pretty.
And these are just temps, right?
Mhm.
And so you said do the brush just the teeth,
Mm-hmm.
but use the
The water
syringe.
peak or whatever, or the syringe.
for the gums and stuff
Yes.
like down here.
Yep.
Okay. And then the water pick later when you can, like 3 or 4 weeks, you said?
Yeah, when you feel so,
When you feel like,
remember you're gonna need a water pick. This has 10 spots, right? You're gonna start off with 1, and then you're gonna go to 2, and you graduate to 3 to 4 to 5, and you're gonna get each one gets more intense, right?
oh, okay.
What I care about is that you get all the food out from under there. So right now you're gonna
Yeah.
use that syringe that we gave you. Do you want to grab one real quick, and I'll just show it to you real quick. And then, like I said, usually about 3 to 4 weeks is when patients feel good enough that they can actually start to use a water pick.
Okay.
And you'll start with like a 1 or a 2, and you use it to the point where it's still comfortable. If you start to hurt
Right.
as you're doing it, that means you're going too hard.
Then you're too hard.
Okay.
Okay.
By the time you get to about 4.5, 5 weeks out, you're going to be where now you can pretty much hit it with
I'm
any
just
speed.
going to smile the whole time.
That's right.
You look beautiful.
Your smile is going to change a ton over the next 4 months, because you're going to get that confidence that we've been talking about, right? And so that's why when we come back here in 4 months, you're going to feel totally different, and you may want to try something different too. And again, this is just one version. This is Dr. Hendricks'
Yeah.
version of what we talked about.
The composite.
Yes,
and
this
then
is a
it
composite,
gets
and then we're going to
nice
do.
and silky smooth. And
It's amazing how much they look like your teeth.
I know.
I tried to
really
keep
do.
what I call the
Yeah.
best aspects of the teeth she had.
Yeah.
Right? Like
Yeah,
I
you
thought,
did.
because I think that God did a pretty damn good job with you the way you are. But I just basically added where I thought, okay, let's do a little bit of changes here and here. So it should feel like it should feel really similar in certain areas because of the areas we kept.
Yeah, it does. I mean, obviously the back is new,
Yeah.
but up front.
Well, even the tooth that was kind of pushed back in a little
Oh
bit.
yeah, I did not like that.
Yeah,
And
but
this
it
looks great.
still looks like same tooth, but it's just in the right spot. now,
Yes.
You know.
So yeah, I'm really happy with the way they turned out.
Me
The
too.
gums are really high in the lower, and that's why the lower you'll really feel like that's probably where you're gonna get most food caught initially, was the gums start to go down.
Okay.
And that's okay. The other thing I want to encourage you, I want to start doing, I'm trying to tell all my patients at this visit too, is floss.
Floss. Okay.
So you're going to push floss through in areas where you can get it through, and then just think of it like a massage. You're
Okay.
massaging your gums. What we want to do is the more that we can stimulate the gums, the healthier they're going to be.
Okay.
Because from this visit to the next is testing and calculations. And we want to make sure that your gums are perfectly healthy, that we can move forward at that visit. It's a bummer when we say, sorry, they're not quite ready because you're getting food caught in there. So get in the habit of using the floss. Long term, when we get the finals in, you won't have to use floss if you don't want to.
Oh,
But
I
it's not,
always
a
use
lot of times
flosser.
people love it.
Yeah.
But you'll use a combo of water pick and floss initially, again, and then after that, you can decide what works best. We'll tell you when you come back for cleanings if you're doing good. But if you're doing great, we'll be like, whatever you're doing, keep doing it. You know?
So that will kind of build back up the gums. That's what you're saying. As long as you're
Actually, the opposite. We're trying to get the gums to settle down.
to settle down.
Because they're
Okay.
swollen, right?
Yeah. So yeah, right now they're swollen because of
Okay.
surgery, but they'll go down over time. It's kind of like if you cut yourself, you initially
Yeah.
start to swell, and then the body comes together, and then it starts to lay back down where it should be.
Okay.
And so we just want that to be as close to static, meaning not moving
Okay.
as possible.
Yeah.
So
Makes sense.
No.
other questions?
No.
This is the syringe.
Yes.
You probably already got one of these.
Yes.
You can have a second one.
Thank you.
But that's what you use. You'll just fill it up with the blue stuff, the Paradex.
Yes. Mm-hmm.
It can be warm salt water also.
Okay.
Okay. And you're just going to squirt in there. You're not trying to you're not trying to
Dislodge
crush it.
anything. Yeah.
You're just trying to get any food that maybe you've gotten in there while you're eating.
Okay. Like down in here and up
Yeah.
in here. Okay.
Okay. Other questions?
No, I mean, I just love the idea that they're going to be all shiny and like
Yes.
new and they're all
Mhm.
done. And I mean, they're new now. But you know what I mean?
So these will look very similar to the permanent ones,
If she wants.
unless
Yeah.
you try.
She right
make
now
some
she has the
adjustments,
steering
yeah.
wheel.
Yeah. Yeah.
Meaning that, okay, because my first version was my first take at it. Second version is gonna be great because you're gonna have a better idea what you want.
Right.
That's where you might say, Doc, you know what? What if we made these teeth a little bit longer? Maybe you do your homework. I don't
Yeah.
know. We'll see.
Yeah, I don't know.
If you do your homework, and you're like, you know what?
I'll do
What
it.
about this? And if you do, again, a lot of patients will say, I love them, and then they'll just say, can you just do this one thing?
Mhm.
It's like a slight modification, but
One gold cap. Right?
but they look beautiful. But as far as how real they look, the finals look so much more real because we're dealing
Mhm.
with porcelain and we're dealing with like a lot of different colors that we're putting into it. And so
Right. And this
Yeah.
is the not this one, but the final will be the zirconia.
zirconia, yes,
Yeah. Okay.
exactly. Other questions? These are all awesome questions.
No, I think I just want to cry.
Is there any checks or follow-ups, or I guess basically when would be the next time?
So next time we'll see you back, unless you call us, will be 4 months.
Okay.
Okay.
Okay. Now here's the 911 call. You can listen. You can forget everything else I've said besides right now. Okay. If the device starts to move,
Okay.
that's the 911 call. You call me immediately. You text me. You email me. And then if you don't get us, you just walk in my door. No, I'm joking, but I'm actually serious. Because the reality is this is that it's sometimes just because everything's so new, you might grind your teeth at night. And if that happens, sometimes the screws that are in there can loosen up. It's
Oh, I
nothing
see.
big. It literally takes us 2 seconds to tighten it back up. But if you don't tighten it up, it can cause implants to fail.
Oh, got
Okay.
ya.
If the device breaks in the next 4 months, again, 911 call. Okay.
911 call.
It's one of those things where we can get you right in. A lot of times it's only happened a couple times in the last couple of years. It's very, very rare in
Okay.
temporaries. But just call us. Okay. And then the 2 things that you can control to make us be successful here is diet and
Yeah.
hygiene.
Yeah.
Okay. Hygiene means you have to brush it, floss it, water pick it. That's all on you. The second thing is diet, and that is just sacrificing your normal the normal menu for
Totally get it.
Yeah.
You just don't want to waste these.
Yeah, I mean, I've had recently had some patients come back that just didn't listen to me, and it was sad, and it's a bummer for us. We're all like sad.
Yeah.
We're having to
gotta
start
redo
from
it.
scratch again, and
Yeah.
it's really
Oh,
sad.
wow.
And these are things that now we have to go back into surgery. They have to pay an extra fee,
Mhm.
and I never really want to make anyone pay more, right? I always want
know.
everything to work out perfectly.
Right.
But and so but I know you're going to do great. You've been waiting for years. You've been following me for years.
Mhm.
You've done it the right way. And so
Yeah.
in 4 months, we'll come back, testing, calculations. That visit usually is about a half a day. Sometimes it takes a little bit more.
Mhm.
But that's where if you have any ideas or thoughts or concerns about what you want to see next mile, bring them there. And we're going to
Okay.
talk about it, okay?
Okay.
You can schedule that visit. And then I would recommend you scheduling the next visit also, because we're going to do calculations and we're going to do a try-in. You can do
Okay.
that within a week apart.
Of each other.
Yeah.
Okay.
And if you lock it in now, you get the timeline gets nice and solid for you.
Yes. Okay.
Versus like if you schedule right now, it'd be like, oh, our next appointment's 3 months out. So again, I'm just
okay,
trying to,
so we should.
I'm mentoring you as we speak.
Thank you.
Do you have other
We're-
questions?
I don't know.
The fact that you're not in pain, huge success.
Mhm.
I'm glad you like your teeth. Again, I think I already have some ideas and thoughts already as you've been talking, and I'll share all those with you next time you come.
Wow.
But I think it's a great start to your next and final smile. So
I do too. And that's the overbite that should be there.
yes. And notice how you don't have the crossbite on that side anymore.
Yes. Yes.
And I think it's going to help you a ton as far as your, headaches and as far as just being uncomfortable because you have so much tension in your muscles. So,
Yeah. Oh,
okay.
these look so good.
Well,
Thank
I'm
you so
really
much.
happy.
No, appreciate it.
Thank you
Thank
guys. You guys are
you.
All
awesome.
of you guys.
Yeah, all of you. So
Valentina, rock star over
good.
here.
Yeah.
Yeah.
She's the one that should be on picture instead of me because she's
all
bigger. So, okay, well, let's get you guys out of here.
right, and get you guys out of here.
You guys are great.
So
This is
should
my
we-
daughter, by the way.